Cost containment means strategies to reduce healthcare expenses while maintaining safety and quality. It affects everything from staffing to supplies. We must support staff satisfaction so hospitals can retain a strong and qualified workforce. Healthcare spending is climbing, but resources are shrinking. Nurses face the challenge of delivering high quality care under financial and resource limitations. As the need for nurses intensifies, staffing limitations don't allow for nursing schools to accommodate the growing demand. As the need for nurses intensifies, staffing limitations don't allow for nursing schools to accommodate the growing demand. Diminishing resources include staff shortages, limited equipment, and lack of funding. These issues directly impact bedside care. Nursing shortages increase workloads, compromise patient safety, and raise stress, while hospitals aim to cut costs by limiting the staff. Research shows cutting costs and fewer resources often lead to higher infection rates, falls, injuries, pressure sores, preventable errors, and readmissions, costing more in the long run. Technology can save cost, but initial implementation is expensive. Nurses must adapt to using tech efficiently to maximize savings and to save time. Medication shortages force nurses to improvise, which can delay care. Cost-saving contracts sometimes limit supply chains or cause massive waste. Nurses face ethical conflicts. They have to balance cost efficiently while advocating for patients. Do we save money or do we go the extra mile for one patient? High workloads and resource strain cause burnout, high turnover, and a costly cycle of losing our skilled nurses. Evidence-based practice directly impacts hospital reimbursements. Those ranking the worst receive a 1% reduction in total payments, emphasizing the importance of preventing hospital-acquired conditions. By using nursing interventions proven to work, we reduce complications, prevent errors, and decrease readmissions. This not only improves outcomes, but also saves hospitals significant money in the long run. Following evidence-based practice in a bundle rather than isolated interventions reduces waste, prevents complications, and saves money while improving patient outcomes. Thorough education, follow-ups, and discharge planning led by nurses cuts down on readmissions. Assess your patient's health literacy to make sure they understand. Accurate, timely, and efficient documentation prevents duplicate tests, billing errors, and improves communications across the whole care team. Nurses reduce costs by teaching patients prevention strategies, like managing diabetes at home to avoid expensive hospitalizations, encourage screenings and yearly checkups, ensure the patient's basic needs are met. The American Academy of Nursing has recognized these nurse-led models to reduce costs, improve healthcare quality, and advance community health. Extending nursing care directly into patients' homes reduces readmissions, improves convenience, and makes care more accessible. They also support early intervention and consistent symptom tracking, helping nurses to catch problems before they become serious. In the US, cost containment shows up through nursing shortages, rising drug costs, and the tension between saving money and protecting patients. But every country faces its own unique struggles, whether it's access to basic medicines, understaffed rural clinics, or managing high-tech expenses. While our local challenges are significant, they're part of a bigger story. Around the world, countries face similar pressures, but tackle them in very different ways. Let's shift our focus from local challenges here in the US to explore global strategies.
Cultural nursing solutions help contain costs by reducing misunderstanding that leads to repeated tests or unnecessary use of supplies. When nurses understand a patient's cultural beliefs, patients are more likely to accept treatments and follow their care plan correctly. This improves outcomes, it prevents avoidable hospital visits, and preserves limited nursing resources. Across the globe, healthcare system faces a critical nursing shortage. The World Health Organization projects a 13 million nurse deficit by 2030, a crisis that threatens patient safety and also global health equity. Addressing this crisis requires global investment in nursing education, fair wages, and workforce sustainability. Many countries lack even the most basic healthcare supplies like gloves and IV fluids. Nurses in the low resource setting often care for patients without gloves, syringes, or essential medications. These nurses adapt by reusing equipment and improvising. They also balance infection control with survival to provide safe care despite these limitations. Task shifting allows nurses to take on certain physician roles in communities with severe provider shortages. This model reduces staffing costs while ensuring patients still receive essential care. By maximizing the skills of nurses, healthcare systems can stretch limited resources and also maintain service delivery despite diminishing workforces. While task shifting increases access to care, it can also overload nurses who are already stretched thin. Nurses may also be asked to perform duties they were never fully trained for, which can lead to safety concerns. Without proper support, task shifting can compromise care quality and worsen burnout in resource limited settings. Many countries have very few ICU beds and ventilators, creating major barriers to life saving care. Many sub-Saharan African countries have fewer than one ICU bed per 100,000 people. That's compared to over 20 per 100,000 in the US. During COVID-19, even high-income nations like Italy and Spain faced critical ventilator shortages, forcing hospitals to split machines or convert their anesthesia machines for ICU care. Rural hospitals in India, Haiti, and parts of Latin America often have no formal ICU units and very few or no ventilators at all. So when electricity fails or oxygen runs out, nurses may Cross-cultural nursing practices often support cost containment by using community resources and traditional health beliefs to reduce unnecessary hospital care. When nurses collaborate with families, elders, and cultural healers, patients adhere better to care plans. This reduces readmissions, conserves supplies, and supports sustainable use of limited nursing resources. Mobile health apps allow nurses to reach patients in remote or rural areas. These apps help track medications, symptoms, and follow up care. Mobile health is an inexpensive, effective way to improve healthcare access. Telehealth expands access to care where providers are scarce. It allows international collaboration in care delivery to isolated communities, reducing travel costs and enabling real time nursing support. It allows for nurses to guide assessments and monitor patients from afar. This reduces travel burdens and also improves overall efficiency. Telehealth also cuts travel and no show costs. It prevents unnecessary ER visits. It reduces complications and admissions. It saves PPE and supply use. It preserves limited nursing staffing. And it also avoids costly specialist transfers. Globally, community health nurses reduce healthcare costs by focusing on prevention, health education, and early intervention. Their work keeps patients out of overcrowded hospitals, saving limited equipment, medications, and nurse staffing. In poor countries where there are limited resources, community based nursing is one of the most cost effective strategies to preserve healthcare resources and improve outcomes. The World Health Organization invests heavily in developing the global nursing workforce. Their initiatives focus on workforce education, leadership development, and policy inclusion. These efforts strengthen healthcare systems across the world. By supporting nurses as decision makers, these organizations help nations improve healthcare delivery and resource management. Global collaboration is essential to sustain these advancements. Scarcity often inspires innovation. Nurses in low resource environments create solutions using what is available. Their creativity demonstrates that quality care can be achieved even with limited tools. Innovative low-cost care models allow nurses to deliver safe, effective treatment even when supplies and funding are limited. Approaches like reusable medical tools, solar-powered clinics, and simplified treatment protocols help stretch scarce resources. These innovations support cost containment by reducing equipment expenses, lowering operating costs, and improving efficiency in underserved areas. Using trained community volunteers allow nurses to delegate basic tasks such as health education, vital sign checks, and follow-up reminders. This reduces nurse workload and helps maintain care quality when staffing and resources are limited. Task delegation is a highly cost-effective strategy that stretches supplies, reduces labor expenses, and supports overburdened health systems. Global health training programs prepare nurses to deliver effective care in environments with limited supplies, staffing, and equipment. These programs focus on low-cost clinical skills, crisis response, and resource-smart decision-making. By improving competence and reducing errors, training programs help contain costs and strengthen healthcare systems facing severe resource shortages. During humanitarian crises, nurses face extreme shortages of supplies, medication, staff, and equipment, making cost containment a life or death priority. Nurses adapt by using low-cost interventions and improvising essential care. These strategies help preserve the limited supplies available so more patients can receive life-saving treatment. Humanitarian nurses provide care to displaced, impoverished, and crisis-affected populations. They often work for international organizations such as the Red Cross or Doctors Without Borders. Despite limited resources and personal risk, their commitment ensures that the most vulnerable receive care. Their work represents the heart of nursing. Ethical dilemmas arise when resources are scarce. Nurses may be forced to decide who receives treatment and who must wait. These situations test moral courage and professional judgment. Upholding fairness and dignity for every patient, even in scarcity, remains a cornerstone of ethical nursing practice. Please review the chart. Cultural understanding is vital in providing effective care across diverse populations. Respecting beliefs about health, healing, and family roles improves trust in patient outcomes. When nurses demonstrate cultural humility, they reduce misunderstanding and unnecessary treatments. Cultural sensitivity is both a moral and economic strength in nursing. The United States has more advanced technology, more supplies, and higher staffing levels, but they still struggle with high healthcare costs and widespread waste. Developing nations face the opposite challenge, such as severe shortage of equipment, medications, and nursing staff, which forces nurses to improvise and ration care. These differences highlight why cost containment strategies must be tailored to each country's available resources. Resource levels differ dramatically, nurses face unique cost pressures, and also scarcity shapes patients' outcome. Countries with limited resources have mastered strategies that stretch supplies, strengthen community care, and reduce unnecessary hospital use. The United States can learn from these models by adopting simpler, cost effective approaches and reducing waste in equipment, medications, and staffing. These global lessons can help address rising costs and support nursing working under increasing resource pressures. Global collaboration allows countries to share proven, low cost nursing practices that strengthen care in resource limited settings. By working together, nations can pool data, standardize training, and increase access to affordable supplies. Collaboration supports cost containment by reducing duplication, improving efficiency, and helping nurses worldwide manage diminishing resources. The global challenges nurses face highlight the need for strong, innovative solutions. These experiences show the resilience and evidence based practice can overcome barriers. Evidence based practice helps nurses choose interventions that are proven to save time, reduce errors, and conserve limited supplies. By grounding decisions in strong evidence, health systems can improve outcomes even when resources are shrinking.
Evidence based practice is a systematic approach in decision making interprofessional setting that integrates the best available research evidence, clinical expertise, and client or patient preferences. The goal of evidence based practice is to ensure that interventions, treatments, or policies are effective, efficient, and tailored to individual needs, promoting accountability and continuous improvement in professional practice. Preventing hospital-acquired infections lead to major cost savings by reducing treatment expenses, shortening hospital stays, and avoiding penalties from insurers. These interventions are evidence-based practices designed to prevent catheter-associated urinary tract infections and central line-associated bloodstream infections. Patient education not only improves recovery outcomes but also decreases unnecessary hospital visits, saving costs for both patients and healthcare systems. Chronic disease self-management programs help patients take an active role in controlling long-term conditions such as diabetes, heart disease, or asthma. These programs lead to better health outcomes, fewer emergency visits and hospitalizations, and overall lower healthcare costs. Reducing unnecessary tests and medications improves safety and lowers healthcare costs by preventing overdiagnosis, side effects, and waste resources. Nurse-led discharge planning improves patient satisfaction, enhances recovery, and significantly reduces hospital readmissions and associated costs. By maintaining accurate medication lists and improving communication among healthcare providers, efficient reconciliation enhances patient safety, supports continuity of care, and lowers costs associated with medication errors and preventable hospital readmissions. Strong interprofessional teamwork helps control costs while maintaining high-quality, patient-centered care. The use of technology, such as medication administration and smart infusion pumps, enhance efficiency and patient safety in healthcare settings. When staffing levels are appropriate, nurses can provide timely care, closely monitor patients, prevent complications such as falls, infections, and medication errors. Leveraging community health resources strengthens patient support beyond the hospital by connecting individuals with local services such as home health care, public health programs, social services, and community clinics. Reducing duplication of services improves efficiency and lowers healthcare costs by eliminating unnecessary repeated tests, procedures, or consultations. The long-term financial and clinical benefits far outweigh the cost of providing educational opportunities for nursing staff. Upholding ethical principles such as justice, beneficence, and stewardship help create a sustainable healthcare system that balances compassion with accountability. The future of nursing lies in the integration of innovation, efficiency, and compassion to meet the evolving needs of healthcare. The nurses of the future will blend technological skills with emotional intelligence to deliver smarter, safer, and compassionate care. By combining clinical expertise with strategic leadership, nursing leaders drive policies that promote equity, efficiency, and improved health outcomes for patients and communities. Nurses serve as powerful cost-conscious advocates by promoting high-quality, efficient, and patient-centered care. By embracing their role as both caregivers and financial stewards, nurses can lead the movement toward a more sustainable, value-driven healthcare system. In conclusion, nurses play a vital role in cost contamination by promoting efficient, evidence-based, and preventative care. Through collaboration, innovation, and careful resource management, they help reduce waste and unnecessary expenses while maintaining high standards of patient care. By combining clinical excellence with fiscal responsibilities, nurses contribute to a more sustainable and effective healthcare system.